support programs, all the way to the White House to solve this problem. That I think he was having a little bit of fun with some previous comments that have been made with respect to how easy it would be to get health care. But there is a renewed sense because I think, the comments and the calls that the president has gotten, as well as the vice president and other members of the senior team that have come in and said, we believe that there is a path forward. We have some ideas. We'd like to talk to you about that. I know I've seen some of the reports that have been put out regarding some of the individual members of the Senate and the House that have been up here meeting with our team. And I think there's a lot of people who have some ideas about how to move forward. And we're entertaining those. The Attorney General brought that up and was talking about the escalation of that from the 1980s to now. But I think the interesting thing is that despite the setback that we got last Friday, I think there is a renewed willingness from a lot of members who've made commitments to the American people and to their voters that they want to see this done, and they understand that not getting this done means that, as I said, and the president echoed when he went up to the House Republican Conference, that there's going to be a consequence for this. People need to be taken at their word. There's a lot of members that made a commitment to their voters, to their constituents, that they were going to get something done on this and repeal and replace it and address the healthcare situation, and that hasn't gotten done. And I think that's a concern for them. It is very well steeped in world affairs, especially Europe, NATO, all the issues. He was a leader in the effort to stand with. I've seen parts of the letter, and I know that 40 of them saw that. And I think what we need to do is figure out who wants to engage in a constructive conversation. I understand what they want. But again, it's not just a one-way street. I think the president has made very clear what he wants to do. And I think that to the extent that some of them want to have a conversation, we have a 52-seat majority in the Senate. If there are individuals in there that want to have a constructive conversation achieving the goals, we can do it. But I think they also need to understand the president's red lines. We'll have further updates, and when we do sign it, I'm sure we'll have further details on Y&Z. I understand they have a right to put out a letter and draw their lines in the sand, but I think the president's committed to going down the path he is, and obviously first step is to get to 216 in the House and then address the concerns in the Senate. But he's continued to have conversations with the Senate, and I think that as Obamacare continues to struggle, which it is, the premiums continue to go up and up. I think the question is, will those 40 people understand that they are the ones who are going to be responsible for owning the current policies that are making so many Americans struggle? Countless communities, more and more. I'm sure the president will continue to do things like this. It was an amazing opportunity to have a moment sort of free of politics and to enjoy some collegial moments with each other in the White House and listen to some of the United States and Marine Corps bands play some amazing music and bring people together. And I take issue with I think you're right that there may appear to be certain things, but I don't think there's any. The president's talked about this. He's mentioned this a bunch of times, that there used to be a time when you could sit down and share a meal together, and I think that's what he's been trying to do, is bring groups back in and at least just have a conversation and get to that human side a little bit. And so yesterday was a good start, I think, Jonathan.